from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, everyone. It is Thursday, May 5th. I'm Jessica Lovell, in for Alexis Del Cid today. Welcome to All Things Heart. Here is what we're talking about today. Most of us have experienced it, a simple blister on your foot, right? You'll meet one man whose simple blister nearly led to his leg being amputated, the heart connection to what went wrong. Also, May is Stroke Awareness Month. Can you spot the signs? We're going to help you know when it is crystal clear when you need to call for help immediately. And what on earth does this have to do with our show? You'll have to stick around to find out. Well, have you ever gotten a blister on your foot? Maybe you went jogging for the first time in a while. Maybe you're trying to break in a new pair of shoes. For Richard Pywell, it happened when he was working outside on his farm in Palco, Kansas. Little did he know it would turn into almost having to have his leg amputated. Almost, were it not for the ingenious actions of vascular and interventional radiologist Dr. Adam Alley. We do need to give you a heads up, though. Some of what you're about to see is graphic, but it just goes to show how far Richard has come and the incredible work of his care team.
I'm a pretty much joker.
Richard Pywell is the kind of guy who can keep a sense of humor about pretty much anything, even this.
I don't have toes to push down with, so I got to be careful when I'm climbing a ladder that I don't try to step on the ball of my foot.
While being shuttled around to follow up doctor's appointments by his devoted wife Carol is not exactly his idea of a good time, or hers for that matter, after 60 years, they know how to take care of each other. They're a good team, and this is just part of the package.
We bicker, but we love each other. We have fun. He tries to get me riled up.
How's it going, guys?
They also know how much worse it could have been for Richard.
Well, from where we started, I don't know if you remember, they were planning on cutting your whole leg off right there just below the knee.
It all started when Richard, a longtime diabetic, got a blister on his foot while clearing some brush. The blister got infected and continued to get worse to the point where doctors told him they needed to amputate his leg below the knee.
Limb salvage is one of my areas of interest. I'm pretty passionate about it.
That's when Dr. Adam Alley, a vascular and interventional radiologist, was brought into the case to work his magic.
The way we like to say it is saving limbs is saving lives. Diabetic population, people with diabetes, you can get what we call small vessel arterial disease. You can get blockages in your blood vessels just like in your heart, so you can get a heart attack.
It was a procedure that Dr. Alley knew about, but had never performed before.
So they called me to see if he'd be a candidate. He was the first one that I had performed.
What do you think?
It's rather incredible.
It would turn out his first one was a home run.
It worked out better than our wildest dreams, so that's great.
It has. Like I said, I'm very fortunate, I guess. The good Lord has not decided to take me yet. So.
Or his leg.
Thanks.
And we want to welcome our guest this morning. Richard is joining us virtually from Palco, and here in studio with us is cardiologist Dr. Kamal Gupta and vascular interventional radiologist Dr. Adam Alley. Guys, how are you today?
Very well.
Good.
Thanks for being here with us today. And Richard, let's start with you. Make sure get your questions sent in to us if you have any. You can go to Facebook, YouTube, or also email us. So Richard, we have got to know, how are you doing? Get us updated.
I'm doing very well, I guess.
So tell us, how are you feeling since you had your procedure? And what are you able to do?
I feel, I do about everything I've always done. I'm always active, doing projects, hobbies, and rebuilding things, tearing them apart and putting them back together.
So you're still active on the farm?
Yes, I don't farm though. We just rent the farm out. So.
Well, it's good to know that you're doing well and you're staying active. Dr. Alley, it must feel really nice to see and hear that Richard's doing well. Tell us about that, what it's like when you see your patients after.
It is rather incredible. So this is the reason that we do what we do. So with Richard, his foot was pretty severe. He was in a place where what was being offered to him was what it's been for a long time, the below the knee amputation of his leg. And so when you see someone like this, and we're incredibly excited that we're able to help out and he's still moving around. The fact that he was able to keep his leg is a huge win for us, and we're very, very excited about it and couldn't be happier that he's still out and about.
He is in good spirits. So we saw the images, and they're pretty startling. When you first met Richard as a patient, did you assume that amputation would have to happen, or did you have to dive? Clearly, you had to dive more into the case, but did you assume that might be what the case was going to be?
Yeah. So for me, I've spent a lot of my career doing this type of work, so I've seen this type of process in the foot a lot. He did have an angiogram before, so I kind of knew what his vessels looked like. And all things being equal in a regular situation, I would have just assumed that he would have moved forward with the amputation. That would have been the next step. Thankfully, and it's great to see how well he's doing. There was a new procedure that we were able to offer, and it turned out really well. So.
Dr. Gupta, as a cardiologist, could you tell us what potential limb amputations, cases like Richard, what kind of make that heart connection?
So most people who go on to develop lack of blood flow in the foot or the toes, that's because of blockages in the arteries that go to the foot. And blockages are, in most cases, unless it's traumatic, due to deposition of fat and cholesterol. And other risk factors are high cholesterol levels, smoking, diabetes. Now, the arteries that go to the foot are same as arteries that go to the heart. So patients who have blockages bad enough to cause threat of limb loss also have silent buildup of blockages in the heart. So more than half of patients who come at a stage where they are at risk of losing their foot are also at significant risk of having heart attack and other associated problems.
And you wouldn't think that. It's quite a ways away from the heart, but it all comes back to it, right?
Yeah, so anytime somebody comes with a limb problem to Dr. Alley or other vascular specialists, they always think that what's going on in the heart. And even if they don't address it right away, they're always talking to the patients about that.
Richard, I want to talk with you again. So the pictures really are startling to see. How long after the blister, that simple blister you thought you had, did your foot start to look like that?
Well, it was several months. I mean, the blister was worked on at the Hayes Medical Center, a couple of times to get it to heal up. And it took about a year to do that. So, and then for the Charcot foot that I had, they recommended that I see Dr. Horton there at the medical center in Kansas City.
So the blister.
After he operated on my Charcot foots when the infection and set in. So.
Well, by looking at those pictures, it must have been excruciating. What kind of pain was it? I mean, give us a 1 to 10. How did that feel?
I said I'm not real sensitive to pain, so it wasn't that bad. Probably 7 or 8.
So,
on a scale of 10.
So did you still have feeling though in the foot?
Yes. I still have feeling in my toes. They're not there.
So you still feel something?
Yes, not much.
So, Dr. Alley, last year the American Heart Association had a big goal of reducing non-traumatic leg amputations by 20% over the next decade. One of the key causes, peripheral artery disease. Is that what Richard had?
Yes, so that is what Mr. Powell had. Unfortunately, the situation remains with peripheral arterial disease that a lot of patients in the country, the data will show, will go straight to amputation with ever having an angiogram or a complete vascular evaluation. So one of our goals is to increase awareness. We have a wonderful multidisciplinary team at KU. It's very fortunate to be able to work with Dr. Gupta and Dr. Horton to help manage these patients so that you can get complete care. So not only is it our goal to sort of advance peripheral arterial disease, but when you're here, as Dr. Gupta mentioned, we can also go ahead and get you a full cardiac evaluation. And the other thing to remember with these patients, because it's small vessel occlusion, there's also an increased risk of stroke. So it's a complete care thing with our orthopedic surgeons, our vascular specialists, and the entire team. What I like to mention with this, and the reason that it's very, very important to us, is once you start getting major amputations in the leg. So what we're talking about in patients with diabetes, once the amputations start going above the ankle, so once your leg starts getting amputated, your life expectancy is going to dramatically decrease over the next 5 years. So what we try to do is, when we use the phrase saving limbs is saving lives, that's really what we're talking about. So if we can prevent you from getting that amputation, in addition to your increased quality of life, like Mr. Pywell, before he probably wasn't able to move around as much, or he wasn't, with those wounds on his feet, it is also going to hopefully increase your longevity of life as well.
So was this related to diabetes?
It's part of it, yes. So the data that I'm giving you is in the diabetic population. So as opposed to, let's say, someone who had an amputation in a car accident or something like that, that's going to be a different set of data. This is for people with peripheral arterial disease, and it's more of a chronic process than something traumatic.
And you mentioned it a little bit, how you and Dr. Gupta and the team work together. Dr. Gupta, how does that work as a team? And what are those conversations like when someone like Richard and patients like Richard come to your team?
So, I'm going to briefly talk about our multi-specialty vascular team. So we are in a really good place at KU right now. It took us 10 years to get there, and I can say that there are very few, if any, centers around the country where different specialists work together in the same physical space or in different places to help patients with vascular disease. And as Dr. Ali said, these patients are diabetics or have history of smoking or kidney disease, and they're at high risk for having not just leg problems and wounds, but heart disease, stroke, and other blockages in the gut and other areas. So we are able to work very closely together and have patients see different specialists to help with different problems and identify problems that may not be aware.
Well, and you're right, because I think when we think of different problems, you think of certain symptoms that just go with one problem and all these different specialists that you have to see, but it must bring a lot of confidence to a patient to know that you're all talking to each other.
That is correct. And now that we have a dedicated vascular center at the Indian Creek campus in Overland Park, where Dr. Ali and myself and my other colleagues and our vascular surgery colleagues are present every day together. The patients don't have to schedule a separate appointment many times, and many patients come from far, like Hayes and others. So if I'm seeing a patient in the clinic and I feel that he needs services of Dr. Ali, I can just say, just walk over and say, hey, would you mind? And so the patient saves a trip, and he has not just one but two different opinions at one time.
And that's how we reach people far and wide, is making it as convenient as possible, everybody working together, kind of one and done. I want to talk a little bit, Dr. Ali. First of all, I have a question. So how does because I want to talk about the procedure and how you were able to save the leg, but how does a blister turn into that? How does a blister turn into these photos that we're seeing?
Yes, so what happens is when you have a wound of any type, the way your body works, it needs blood to heal. So the blood will enter that wound or that ulcer. The blood carries, white blood cells and a lot of different cells that can help promote wound healing. Once you don't have that blood flow or it's compromised, the wound doesn't receive the type of wound fighting cells that it needs to help heal that. And so what happens in that scenario is the wound will start getting bigger, it'll start getting infected, because of the lack of blood flow. And so if you can restore that blood flow, and with the appropriate management and wound care, you can hopefully heal that up. And so that's how that happened.
So what made you so sure you were going to be able to save his leg with this new surgery, this new procedure?
So I didn't know if how it would work out, to be perfectly honest. What I did know is that his next step was full amputation above the ankle, like we had talked about. I was aware that this procedure had been done, quite honestly, it's very, very new. Definitely that was my first time to do it. I've done it a handful of times now. And just a brief description of kind of what it is. So what we generally do is when you get a blockage in your artery, and an artery is a blood vessel that takes blood from the heart to the area that it's going. What we try to do is open that area up. Eventually, if you think about a garden hose and it fills with cement, none of the water, or in this case the blood, can get through. There is a situation where unfortunately there's no options for the foot because the concrete in there is so severe that we can't open it back up, and there's no surgical options for bypass. So what this procedure is veins take blood from the body back to the heart, and what we actually do is create a connection between the artery and the vein and reverse flow in the vein to the foot. So we more or less turn it into an artery to try to restore blood flow that way. Now obviously the veins and the arteries have different properties, and so the medical community, or in my specialty in particular, are studying this vigorously to see what the future of this will hold, but it's shown some real promise. I'm excited to be part of the multidisciplinary vascular team here at KU because we are dedicated to advancing the field and offering the latest that is out there at all times. That's why I'm here, and that's why I do what I do, and I was very excited to be able to offer that to Mr. Pywell. He was the first one that was referred to us for that in particular, and so it turned out really well. So.
Richard, what does it feel like to be the first?
Well, feels great. I'm still here.
But it has to feel good to know that you're kind of a living, walking example of the work that Dr. Ali did, right?
Yes. Yes,
What do
I'm
you,
very fortunate.
How long did it take you to recover and kind of get back to doing the things that you love?
No, it was pretty much probably over a year, that it took to get everything healed back up to where I can, do what I do. I mean, I'm always working on welding and building things and designing things, and restoring things. I've got a project I've started restoring a 56 Packard, so I've got it pretty much tore apart and put it back together now.
Yeah, you can't be slowed down. You've got work to do. Did it heal the way you had hoped it would?
It certainly did. So it was when I saw him in the last follow-up, his foot looks great. He's got great signals in his feet with his vessels. And the one other thing I'd like to mention is that Richard takes accountability and takes care of himself. So the follow-up stuff that we encouraged him to do to keep his doctor's visits, his medications, his wound care, he did all of it to a T. And
so he's a good patient.
And that is, yes, and that is that's always a big part of it. And yeah, so it couldn't have gone better.
You agree, Dr. Gupta, how important it is to have a good patient that listens and is self-advocate of their health?
It's a shared responsibility, and both parties have to be deeply committed to the cure of the disease. So absolutely, yeah.
I want to get to some community questions because we've got some really good ones. Frank is saying, can you ask Dr. Gupta if limb loss is associated with heart problems? So do heart problems cause limb loss?
Absolutely, indirectly and directly. Patients who reach the stage where they are at risk of losing their limbs because of arteriosclerosis or atherosclerosis, which is deposition of fat and cholesterol and calcium in the arteries, and they reach that stage, then the risk of mortality or dying at 2 years is almost 50%. So half the people who reach the stage that they are in risk of losing the lung, half of them will not be alive in 2 years. And a lot of that has to do with high risk of strokes and heart disease. So that is a direct link. And then once you have had an amputation, mobility is restricted, as Dr. Ali was saying, and if you're not mobile, you're sedentary, your risk of all the diseases go up, and so the risk of dying goes up.
Suzanne wants to know, was there anything Richard could have done differently to keep this from happening, Dr. Ali?
Well, Richard's, so with diabetes and with your overall health care, it's always important to remember that diabetes is a treatable disease. So what we always advocate for is that regular checkups with your physician, maintaining your diet, your medications, regular screening is of paramount importance. In Mr. Pilo's particular case, he's, as we get older, things can progress. He's made it, a long way doing what he's doing, and he looks like he's doing pretty good. The important thing for us in the medical community is to make sure that we get what we know out there. And so once we get the information out there, I think that's a big part of it to help people understand that a lot of the things that can be preventable, we can already treat. And so there's a lot of good medications out there, a lot of specialists and physicians ready to help. So
Prevention is key.
Yep.
Kara is asking, does Dr. Gupta refer patients to doctors like Dr. Ali often?
Yeah, so when we work in a multi-specialty vascular team, there are vascular surgeons, there are cardiologists, there are radiologists, we all work together, and many of the things we do are similar in terms of opening blockages. But procedures like this one that Dr. Ali did, we all would refer our patients who need something like this to Dr. Ali because this is a new procedure and it's not that something is done routinely. So if I have a patient that I feel is no option, like our patient here was, Mr. Pyle was, I would reach out to Dr. Ali and say, hey, is this somebody in which you can work your magic and do this? And if he says yes, then it's good for the patient. So we work very closely together, and Dr. Ali is the guy for this procedure.
Work your magic, no pressure, right, Dr. Ali?
There you go, yeah.
Right.
happy to do it.
Yeah.
Jenny wants to know, can Dr. Ali explain what PAD is?
So-
how do you screen for that?
So PAD is peripheral arterial disease. And what peripheral arterial disease is as Dr. Gupta described before, is when you get blockages in your blood vessels. Screening for it can be pretty straightforward. So symptoms you can look for at home is if you are noticing that you're able to walk less and less without getting pain in your calf or your foot in particular. If you start having rest pain, or particularly if you see a wound in your foot without a trauma that you remember and you didn't hit it or something like that, it just sort of showed up. Those are signs to look for that you may have peripheral arterial disease. Screening for it is straightforward. There is an easy ultrasound examination that we can do that tests for a number. It's something called an ABI, or an ankle brachial index. And your doctor will routinely order those just at your regular primary care office. It's something that most physicians are aware of. And in addition to that is the physical exam. So,
And the PAD questionnaire, how does that help?
So what that's going to go through, it's a great question. The PAD questionnaire is going to go through to see if you have some of those symptoms that I just talked about. And so in addition to a few other ones. So if you start answering yes to those questions, you may have symptoms of peripheral arterial disease, and that would prompt you to maybe go in and see your physician and get that easy screening exam so we can stay on top of it sooner rather than later.
Couple questions for you, Richard. Ashley wants to know what it feels like now when you walk. What kind of feelings do you have in your feet? And also, do you get any phantom pain or itching?
It's pretty normal. I mean, I don't have a whole lot of feeling in my foot. It doesn't hurt. And like I said, I just pretty much walk pretty normal anymore. Other than my stability's not there, but then I'm 82 years old too, so.
We think you're doing a pretty good job. Derek wants to know, and you mentioned this in your story, and you did talk about this, about saving a limb means saving a life. What do you mean by that again?
So again, once you, it's a good question. Once you start getting major amputations, so once you start getting amputations in your leg above the ankle, your mortality or your survival is going to get dramatically less over the next 5 years. So if we can prevent you from getting that amputation above the ankle, if we can save your foot or save your limb, hopefully you will live longer. So that's the idea. So if we are saving your limb, we are, as a good phrase, saving your life. So hopefully helping you live longer. So.
Makes sense. Katie wants to know, I have diabetes, so should I be more worried if I get a blister on my foot?
If you do have a blister, it's important to make sure that it's healing. So if you are managing your diabetes well, your hemoglobin A1C is within appropriate ranges, you're following with your physicians, you get that blister and it heals up within a month, you can continue to go on. If it doesn't heal, or something we call a non-healing wound, that's something you need to, I would say, get attention for right away.
Is that for anyone, diabetic or not? I mean, I never thought a blister could be so problematic.
So if it's not getting better, so a good rule of thumb for a non-healing wound is it's not getting better after a month, or it's still present after 2 months. So if after 1 month you're not seeing any improvement in that wound, or it's probably getting worse, diabetic or not, I would definitely recommend going to see a medical expert to get that addressed.
I want to get to our final thoughts today, and I want to start with Richard. Richard, just your final thoughts, what you want us to know, or you can just say hi to Dr. Ali, whatever you would like.
Well, I'd like to say hi and thank you. And like I said, I've been very fortunate that I've never smoked and never drank in my life. So like I said, I've had a good life, and hopefully it'll go on for a few years more.
We're happy to help. It's a pleasure. It's a pleasure to have you as a patient.
And thank you for sharing your story. It's not always easy to share our medical history, and we really appreciate that. There's a lot to learn from you. Richard, thank you. Get after it. Okay, Dr. Gupta, your final thoughts. Glad to have you today.
Thank you very much. I like to say that especially if you're a diabetic or if you smoke, unfortunately, you don't need to see a vascular specialist first off, but do follow with your primary care doctors regularly. They are trained to examine your feet, to check for pulses, and if you don't have pulses or weak pulses, then they will refer you to an appropriate cardiovascular specialist. That's it.
All right. Thank you for your information and your insight. Always appreciate it. Dr. Ali, your final thoughts for us.
I would just like to say what a privilege it is to be part of the team here. Part of our goal is to get awareness out. And I think that things like this, continuing to strive to advance the field, countless physicians and scientists working to collect data so that we learn more and more is paramount. So please continue to support your healthcare professionals.
So I'm going to share a couple more pieces of information, but I'm not quite done with you both. We're going to come back and have a little fun. All right, well, we have a special event coming up that we want to tell you about, a tournament with heart, if you will. It's called Golfology for Cardiology. It's September 19th at Shadow Glen Golf Club in Olathe. You're looking at some previous events from the past. This tournament helps raise money to help cardiology patients here at the University of Kansas Health System. And we had a chance to sit down with interventional cardiologist and the chair of the cardiovascular department here, Dr. Mark Wiley, about how this money will be used for an incredible program easily accessible for patients anywhere in the region with a virtual cardiac rehab program.
One of the biggest limitations for cardiac rehab is the geographic spread of our patient population. We're fully committed to a virtual cardiac rehab experience, and so we're hoping to use the money raised from Golfology to do that this year.
And that would be so incredibly helpful to help all sorts of patients who live several hours away. Patients like Richard, who, if they ever needed cardiac rehab, could do it virtually. So start practicing your golf swing now. Register using the QR code on your screen, and we will see you out there. Well, May is Stroke Awareness Month. The American Heart Association says someone in the U.S. has a stroke every 40 seconds. Strokes can be devastating and they can be deadly. So do you know the signs of a stroke? Well, as we know, time is of the essence. So remember this, be fast. Take a look at your screen. B is for balance. Is walking difficult? E is for eyes. Are there vision problems? F for face. Do you see any drooping? A for arm. Is one arm weak or numb? And S is for speech. Is it unclear or slurred? And T is time to call 911. This is such important information and such an important topic that we're currently working on an entire episode dedicated to how strokes are related to the heart. Well, one of the coolest parts of the show is getting to know our doctors a little bit behind the scenes and what makes them tick outside the walls of the health system. Yes, they actually do have a life outside of these walls, and it's called Behind the Mask. So first we want to start with our cardiologist, Dr. Kamal Gupta. When Dr. Gupta isn't saving lives, he's hanging out with his two best buds. This is Duke and Ali. Tell us a little bit about them, how they fill your soul.
They're our babies.
They're your
My
babies.
wife and I. And our kids have left for college, and so this is it. So Duke is 8 years old, almost 8 years old. He's becoming a grumpy old man. Ollie is younger. He's a rescue. He's a boxer hound mix. He's 2 years old, and he gets on Duke's nerves. You'll see me out there every morning at 5:30, rain, snow, shine, sleet, walking these dogs.
So they're spoiled.
They're spoiled and they have no judgment. There'll be nobody out there, but we'll be out there.
So they're walking you. Do they sleep in your bed, I have to ask?
No, they sleep in their kennel.
Good for them. Well trained?
They go to their kennel on their own at night, and they stay there until we lock them.
Wow. Okay. And so how old are they, you said?
8 and 2.
Oh, fantastic. Do you walk them out? Do you walk them in parks? And
Yes, there's no park that we have not visited. There's no trail. We've mapped the whole 26 miles of Indian Creek Trail.
Good for you. I love it. I love it. Adopted dogs, too.
Yeah.
Okay, Dr. Ali, you're up next. So we asked you kind of what feeds your soul outside of the hospital, and this is what you texted us. So he texted Alexis and was like, will this work? And we were like, yeah, I think this will work. So where is this? What is this? Tell us all about it.
So this is, so that's the flyboard. So this was, I took a trip to Miami. I usually stay pretty active. I like to travel, and I'm always looking for kind of fun stuff to do. And so we took a trip out in the harbor, and one of the things you could go with was to try this experience. And so you strap on there, the hose is attached to the wave runner, and they shoot you up, and he teaches you how to stay balanced. And it's actually, it was a lot of fun.
Okay, it looks like you're having to put a lot of muscle into that, I have to say. That does not look easy at all.
Yeah, I mean, it was a little bit of a workout, and I did send you maybe the second or third one, and not the first video where I
where you just crashed and burned.
fell immediately. Yeah. So.
Well, very talented. Yeah. What does happen when you fall? You just splash down.
You're in the water. You splash down and
get up and try it all over again, right?
Again, yeah.
Well, that's really fun. Thanks, guys, for letting us kind of get a little personal with you. We got to do it sometimes, everyone. Well, thank you so much for being with us today. Next week on All Things Heart.
At the time that it happened, I thought that it was probably the worst thing that ever happened to me. But as it turns out, it was one of the best things that ever happened to me.
After a stroke and multiple surgeries, Terry thought he'd seen it all. We'll tell you the heart connection that led him to having all of his teeth removed. That's next Thursday at 10.